Thanks, everyone. It's nice to sort of see all of you tonight. I prefer giving talks face-to-face so I can see if I'm connecting, if I see folks of confusion, but we'll just have to go with this format. And if there are questions in the chat box that Anne or somebody else could pass along to me if those come up, that would be great. I'm Christina Studebaker with United Way of Door County. I'm a Community Impact Coordinator focusing on improving the financial stability of community members across our community. And tonight I'm going to talk about a group that we refer to as ALICE in Door County, which are people who are working and struggling to make ends meet. And so if you can go to the next slide. Thank you. This acronym, for those of you, some of you might be familiar with this and others might be unfamiliar. This is an initiative, a research initiative by United for ALICE, which is United Ways across the United States, and it stands for Asset Limited, Income Constrained, Employed. So that is essentially people who are working and still struggling to get by. I'm going to go through some data, but before I go through some data, I want to give you an example, a real-world example of someone who is in the ALICE population in our community. So if you could go to the next slide. As part of the work that we've been doing to better understand and meet the needs of community members who are struggling, we reached out and asked people, community members, to share their stories with us. We have access to lots of data which talk about things at the community level, the county level, the state level, but behind those statistics, stories. And hearing those stories really help you understand the day-to-day struggles that these individuals, these families go through. So there was a family that recently sent us a note in regards to the work that United Way is doing. And I'm going to read excerpts from this to help you understand. So this family writes, "We're a young family of 4. My husband got injured at work in late 2019 and required knee surgery. Unfortunately, his knee didn't get better. He could no longer work at his job that required a lot of physical activity, and he was let go. A couple months later, he had another surgery, and he's currently out of work. We had a baby in the spring, and I stayed home as long as I could to be home with the baby, but then I had to go back to work. I don't make very much, and there are no benefits, but it's an income. Our other child recently started kindergarten and has to do virtual learning, which honestly is a major headache. We cannot afford internet, and the hotspot the school provided is not very reliable, so it's hard to keep up. Plus, a parent has to be nearby to log on and off and get any assignments. I literally feel like I'm the one in school. I know, however, that everyone is trying to do what they can during these difficult times. We used to have only one small car with 5 seats, but then we got a van from a relative. We were thankful because after getting 2 car seats in the smaller car, there wasn't room for anything else. The van has more than 200,000 miles on it, and we recently learned the transmission is going out. We were told that it's not worth putting a new transmission in the car or in the van, so we're back to 1 car. We barely make enough to pay our bills. My husband takes care of the kids while I'm at work because paying for childcare is out of the question. My husband's health has not been good lately. His joints hurt and he's constantly in pain. He does not sleep well and can hardly even dress himself. The medication the doctor prescribed has not helped. We take things day by day and are hoping that things get better. Thank you for helping our community." So I just wanted to share that because that in one family's story encapsulates so much of the struggle that's going on and helps you understand families that are trying to work and the challenges that they face. So if we could go to the next slide. Thank you. So what we're talking about is financial hardship. If you could click to the next thing. A traditional measure that has been used to explain financial hardship across the country is the federal poverty level. But United Way said that there are issues with that, and so they wanted to take steps to do more real life budgets. So if you could click to the next thing. One more click. Thank you. Sorry. So they're using data that's systematically collected from the US Census and the Bureau of Labor Statistics, other sources that allow us to get county specific information on the costs of things associated with day-to-day life and working. And they've broken this down into two types of budgets by county, a survival budget and a stability budget. And tonight I want to talk to you a little bit, give you some more detail about survival budgets. So if you could go to the next slide. So this just gives you a sense that this United for Alice is a nationwide initiative by United Way, nonprofits, academic institutions, and other organizations across the country. It started in 2009 in a single county, Morris County in New Jersey, and is now in 648 United Ways across the country. So we're glad to be part of this initiative, and the information it provides is so valuable. Next slide. One more click. So like I said, we're going to focus on the survival budget tonight. You can go to the next slide. So this is the bare minimum it costs to live and work in the modern economy. And this is not meant to be sustainable over time. What United Way has done is collect data from various sources to see what it costs. Now, this is not necessarily what everyone is paying. What they're looking at is if you're trying to survive as a single adult household, for example, and they assume that you can survive in a studio apartment. What's the cost in our county for a studio apartment each month? What are childcare costs in Door County? What is food for a single family household, for a family of 4, for 2 seniors? They break all of this down, and they've also got costs on transportation, healthcare, technology. And remember, we're talking about people who are employed, so they pay taxes, and that includes employment taxes. And then they've even added in this 10% miscellaneous, which captures fluctuating costs over time. So for example, in the wintertime, you might have an extremely high heating bill. So it's not like you've got 10% extra to go out to eat or things like that. These are just capturing the basic essential costs that it takes to survive for a household in Door County. Next slide. So these are the categories that I just laid out, and I'm going to give you information on 3 different types of households. And so this is what this initiative has done that is so helpful. It knows that not all households are similar in terms of the makeup that they have and the costs that they need to survive or be financially stable. So we're first going to start with a single household, single adult. And these are the costs that have been collected from those various data sources. So housing assumes a studio apartment in Door County would be $493. Whenever I present this, people say, good luck finding a studio apartment in Door County for $193, but that's what it's based on. So they're conservative estimates that the food for a single adult for a month, $323, transportation, which is maintenance on your car, gas, insurance, healthcare, technology is just a mobile phone. This is a survival budget, doesn't even include having internet access at home. And then you've got your taxes, your monthly total. Now we're going down those rows. We're down to almost the bottom. The monthly amount of money for a single adult to survive in Door County, $1,840. If you multiply that by 12 for a total, you need an income of $22,080 for the year. And if you divide that by 2,080 for a full-time job over the course of a year, breaks down to an hourly wage of $11.04. So that's one type of household, but we know there's lots of different types of households. So the next one we'll look at is a household of 2 adults and 2 kids in childcare. So now this assumes a 2-bedroom apartment rental for these people, and childcare for 2 kids. And you can see that number is just eye-opening, but that's based on real-life data. And then you also have food, transportation, healthcare, technology, and now their total for the year for survival for that family of 4 is $66,216. And the hourly wage, either coming from one person or from both adults combined, needs to be $33.11 an hour in order to make that survival budget for the year. And then another example of a household budget, which is so relevant here in Door County, is a household comprised of 2 seniors. The things that they take into account when they're putting together these numbers is that seniors travel less and they tend to eat less, but their healthcare costs are more. So this research initiative has been really mindful in terms of how it has looked at the data and what it's pulled together. And you see for 2 seniors that we're looking at a survival budget of a little over $39,000 a year, and through their benefits or whatever, if they're working jobs, need to be pulling in $19.52 an hour in order to meet that survival budget. So if you can click one time. So what we've got here, I think I highlighted the wrong thing on my slide, I'm sorry. So I meant to put the red box around the annual total. So what we've got are that they look at these cutoffs, and that's referred to as the ALICE threshold. So the ALICE threshold isn't one number for everyone in the county. It depends on which type of household you are. But then we can look at the data for the number of households in our county that fall into these various categories, and we can tally how many people in Door County are falling below the survival budget, falling below the ALICE threshold. So if you go to the next slide, when you do that, you see that altogether 31% of the households in Door County are falling below that survival budget. 9% of them are even below the federal poverty level, which is much lower than the ALICE threshold. If you could click again. Thank you. So now if you break that down into these different categories, and we look at the percentage of individuals, we have 31 across the entire county, but if we look more closely at the type of households, we see that families with children, 22.5% of them are falling below the threshold. Single individuals, or those who are cohabitating but don't have children, 29% of them, 28% falling below the threshold. And our seniors, we have almost 42% of our senior households in Door County are falling below the ALICE survival budget. And I just wanted to share that so that you can help understand within our county, those numbers look very different than other counties across Wisconsin or across the country. Next slide, please. This data, they also look at it, they break it down by our towns. And one of the things I want to highlight is that the families who are struggling occur across our county. So we see here in Brussels, 36% of the households in that town are falling below that survival budget threshold, the ALICE threshold. 38% in Forestville, and if you click, we should go up. Okay. So then in Sturgeon Bay, it's 38%, and in Sister Bay, 46% of the households are falling below the ALICE threshold. So you see how that takes us from the southern to the central to the northern part of our county. We have struggling families across all of Door County. Can you click again, please? Thank you. So when we understand the struggle better, we wonder, everyone wants to help. And we think that one of the questions is, well, are we just helping those individuals, or do we get more return than even helping the individual families by providing support for them? And you can click here, and we see that what happens is that directly to the households that are struggling, if we can help them, there's decreased stress, which leads to better mental and physical health. There's better access to preventative care, better academic performance for the kids. And then on the right-hand column, you see the impact to the greater community with lower healthcare costs, improved productivity at the workplace, lower crime rates, increased civic participation. You get so much when we help the Alice households, and that's what United Way is focused on doing. And so this has just been an introduction tonight. As you could probably tell, I can talk for a lot longer about this because there's lots of data that goes into this. This was just big picture, but I hope it was helpful, and I'm happy to talk to anyone about this more. You can call us at the office, or you can email me or my boss, Amy Conley, and we're happy to talk more. Thank you.